Our study looked at genetic testing in women at risk for hereditary breast and ovarian cancer. We compared the testing we used to do, which was limited testing only with BRCA1 and 2, because originally that's all we were allowed to really do because of some patents, compared to panel testing, looking at multiple genes all at once. We wanted to do two things. One was to make sure we could still find the same rates of BRCA1 and 2 mutations, the most common gene mutations in patients with risk. And two, what else could we find? How many other patients actually carried other gene mutations, or was it so rare that it wasn't worth doing? So that was the basis for the study. Fortunately, we had a large sample, so we had over 966 patients. 620 or so underwent the limited testing. The other part underwent the multi-gene panel testing. In both groups, we found almost identical rates of BRCA1 and 2 mutations after we controlled for multivariate analyses. So controlling for factors like family history, personal history, ethnicity, age at cancer, we found equal rates of identifying BRCA1 and 2. So we knew that using these newer panels, we're going to be safe. We're able to still detect the BRCA mutations we needed to know about. The other more interesting thing, we kind of expected that to happen. You know, we would be surprised if that didn't happen. But the more interesting thing was we found doubling of detection of mutations. So another 3.9% of patients had mutations in non-BRCA1 and 2 genes. So these are genes we hadn't really been looking at, weren't accustomed to looking at, but we're finally able to do up front. The most common genes we found that were mutated were PALB2, CHEK2, and ATM. If you look at some of the other studies that have looked at other panels, these are the other three more common genes after BRCA1 and 2 that are being found in women at risk for breast and ovarian cancer.